I'm Erica Lunkenheimer, Associate Professor in Psychology and a member of the Child Maltreatment Solutions Network. And I'd like to introduce our speakers and moderate this afternoon's session. Let me just say a little bit about it first. Our afternoon session centers on the developmental impact of trauma. And we know that schools are integral in supporting children's healthy and successful development over time. And of course, our hope is that child maltreatment prevention programs implemented in schools have a long-term developmental impact, supporting our children to become healthy and productive members of society as they grow up, which underscores the importance of intervening early in child development. Also, when children have been maltreated, it's important to consider the impact of this trauma on their developmental trajectories over time, as well as consider how education can be informed with maltreated children, can be developmentally informed to be more effective. So our speakers in this session will address this developmental impact of trauma and this developmental framework in thinking about trauma-informed schools. Our first speaker this afternoon is Dr. Brenda Jones-Harden. Dr. Brenda Jones-Harden is a professor in the Department of Human Development and Quantitative Methodology at University of Maryland, College Park. She's worked over 35 years in early childhood policy, practice, and research. Her research examines the developmental and mental health needs of young children at risk, particularly those who've been maltreated or exposed to trauma. And a particular focus of hers is preventing maladaptive outcomes in these populations through early childhood and parenting programs such as early care and education, home visiting services, and infant mental health interventions. Dr. Harden is the author of numerous publications regarding vulnerable children and families, particularly risk and protective factors that are linked with their developmental and mental health outcomes. She's conducted many implementation and impact evaluations of early childhood and prevention programs. Dr. Jones-Harden is author of the book Infants in the Child Welfare System, A Developmental Perspective on Policy and Practice. She is a co-author of Beyond Common Sense, Child Welfare, Child Wellbeing, and the Evidence for Policy Reform, and a co-editor of Child Welfare and Child Wellbeing, New Perspectives from the National Survey of Child and Adolescent Wellbeing. So her work is truly interdisciplinary, cutting across the arenas of child development, prevention and intervention, and policy. Please welcome Dr. Brenda Jones-Harden.
Thank you so much. And although I'm here to talk about the subject that's closest to my heart, it's been closest to my heart for 35 years, the real reason I'm here is because of Carlo Panlilio. He is a former student of mine, and I miss him terribly, but it does my heart good to see him being a grown-up without me, even though I'm still grieving. But anyway, so today, Carlo has asked me to talk about developmental impact. It's kind of hard for me to just leave it there, but I'm going to let Susan and those tomorrow take it on to the intervention, and I'm going to try to be good and just focus on what trauma means for children. So the first thing I want to start with is the thing that I start almost any talk that I do with, thinking about how early experiences matter. And certainly 35 years ago, when I was a young social worker in New York City, child welfare, I knew early experiences matter, but I didn't know how much. Now we have all this amazing data that says it matters at the level of the brain, which is amazing to me, something I never thought I'd see or learn about in my lifetime. So I'm very much a consumer of this work and really have taken it to sort of push me to think more about what we can do for little kids. So I'm going to start with some definitions, and you probably will have every speaker talk about these, but these are from the National Child Traumatic Stress Network. If any of you have been on that website, you know it's great. If any of you haven't, you should go on that website. So they start by defining trauma as witnessing or experiencing an event that poses a real or perceived threat. Notice the perceived. For little children, we know that perception is reality. So even if they don't really experience maltreatment, if they're around a situation in which there's a lot of violence or something like that, it is perceived very much as a threat. And I'm going to talk a little later about how those threats really go under the skin. They also talk about acute trauma, one of those single events that occur that children can get over, like a death of a family member, right? If you have, particularly if you have this event and you have somebody who's supporting you and caring for you, you can get over those. The worst events, the ones that end up with the worst outcomes, are chronic trauma, those kind of multiple recurring experiences of trauma, and even worse, complex trauma from the perspective of the people at National Child Traumatic Stress Network, which really have to do with interpersonal trauma. So maltreatment, of course, would fall in that category. So there are many, many traumatic events, as all of you know. Illnesses, I mean, there's a paper that I really love about, from Jean Brooks Gunn, about young children who've experienced multiple hospitalizations and multiple separations from their parents. Even those, and we're not talking about children who are in foster care, the kind of kids that we tend to work on, but those separations even lead to poor outcomes for children. So for little kids, we have to think about not only the trauma of experiencing maltreatment, but what we're doing to them after maltreatment, which is putting them in foster care, which is really traumatic again, right? So we have to think about the fact that our system for caring for these children who've been traumatized is another traumatic event for them. So lots of different things. One of the other things that I like to say when I think about these sort of definitions of trauma and what constitutes trauma is neglect, right? So we sort of don't think about neglect as trauma, but one of my favorite quotes I stole from Marion Wright Edelman, who stole from Gandhi, and that quote was, "Poverty is the worst form of violence." And that sort of helps me to think about how child neglect is really, which all of you know and hear is highly correlated with poverty, is really another form of trauma. All right. So I'm not going to go through each of these bullets, but suffice it to say that for children 0 to 5, they are much more likely to experience trauma than any other age group. And I know this is a school-based group here, but one of the messages that I hope to give is that school doesn't start at kindergarten, that it starts way before that when you think about early Head Start, and those represent prime opportunities and venues for us to try and address trauma in young children, particularly because we don't really have another institution that catches them in the way that the school system does. So hopefully you'll hear my argument that we really need to be thinking about this earlier on, and hopefully my colleague Christy Terrell Corbin tomorrow will make you all think about it even more. So basically, suffice it to say that little people under 5 are much more likely to experience trauma than others, and you all might know of the data from the National Survey of Child and Adolescent Well-Being, which is the only nationally representative study about children in the child welfare system that we have. Another thing I never thought I'd see in my career, an amazing study. I'm sure all of you know about it, but if you don't, you got to go on acf.hhs.org website, .gov website, because they've got all these great research to practice briefs that you can download, teach your class with, pass out to legislators. They're really, really good resources. But anyway, one of their major points is when you look at little kids, they have a higher likelihood of maltreatment than older children. And my colleague Fred Wilson, who's at Chapin Hall, has looked at the data from NSCAW as well as from his multi-state data archive, and one of the things that he's found is you got to get lower. So children under 3 are much more likely to have experience maltreatment. Then children under 1 have a higher likelihood than everybody else. And then he even goes down farther and says children under 3 months have a higher likelihood of maltreatment than anybody. So anybody who's done child protection work, you know why this is true. It's the substance abuse, prenatal neonatal drug exposure, all that kind of stuff. But basically that means that little kids are much more likely to be maltreated, much more likely to die from maltreatment, much more likely to have longer durations of foster care, much more likely to enter foster care, much more likely to return after reunification, blah, blah, blah. Go to Chapin Hall and read his paper and you will see these kind of data. So with that, I want to think about what trauma exposure means for these little kids. And I don't have to talk to you all about this. You know that the context of trauma make it even more complex. So it would be one thing if children just experience maltreatment, right? But they're experiencing maltreatment in these other contexts which make them even more high risk, like poverty, like all kinds of sociodemographic risks, like family violence. And many of you who've worked in child welfare know that now we're seeing a lot more kids come into the system because of intimate partner violence. When I first started as a social worker, we didn't bring children in unless they were really directly maltreated. But nowadays, there are a lot of kids who are coming in due to domestic violence. Very high correlation, as it turns out, between domestic violence and child maltreatment for all the reasons that you all might think. So this is where I kind of want to do, I mean, as I told you all, I'm a consumer of the brain science. I try to present it, but I don't really know it well. I'm just trying to read it and learn about it. But many, many people are doing this work. The thing that I would direct you to is a paper by Sarah Jaffe that's in the SRCD Social Policy Reports. It is one of the best papers I've read that summarizes the literature on how maltreatment and trauma get under the skin. She terms it the biologic embedding of trauma and maltreatment. But basically what she talks about in very nice detail, but in a way that even people like me who are not neuroscientists can understand. She talks about the impact of trauma on the young brain and how there's this overall dampening of the brain. So think about what we're talking about in this conference, getting kids ready to do academic tasks when their little brains are not even primed to do the academic tasks. Because what you see is this overall dampening, but you also see atrophy and dysfunction in some particular areas of the brain that are really, really important for academic work. For example, you all know that there's this deep structure, the limbic system, deep down in our brain that is really our emotion center. So it helps things like emotion regulation, which I know Carlo's going to talk about, helps with things like memory for emotionally salient events. So you know, you think about maltreatment and how children have visceral responses. Sometimes you go, how is that possible? The child doesn't have the cognitive capacity to understand this. Well, if you think about all that stuff that happens down in the limbic system, it's you understand why children have these kind of visceral reactions because it's sort of embedded down in these pieces of their brain. So there's all this impact, negative impact on the limbic center, but there's also negative impact on what I say to my kids, your front brain. You know, like Winnie the Pooh says, think, think, think. I've got adolescents who don't use their front brain, and if you all know about the data on the front brain, it's still developing in adolescence, which is why they're wrapping cars around trees and not doing things you tell them to do, because this is not really developed in the way it should be. But we know from the data that this, frontal cortex, which Jack Shonkoff calls your air traffic control system that has executive functioning, by the way, which is highly predictive of academic outcomes, right, that all this part of the brain is affected by trauma. And there are other kinds of things, like the corpus callosum. You all know those fibers that connect the two pieces of the brain, the two hemispheres that help your brain to work more efficiently. You see less dense fibers there. I mean, it's just all over the place. So what we know from these data is that it's not just that trauma impacts children's behavior, it impacts children's physiology, which to me is amazing. It's amazing. The one other piece of this that's not exactly related to the brain is the cortisol production, which I'm sure you all have heard about. There's a lot of research now looking at cortisol production. It's the stress hormone. First time in my life I did a physiologic study. I'm just finishing it now. We looked at kids' saliva. I went to spit camp at Johns Hopkins. Never thought I'd be doing that. I have a little mug that says spit. And my husband goes, how can you even put that mug up to your mouth, right? Because it just is gross. But we have gotten data from saliva from little kids as well as their parents, and we're looking at cortisol production. Stay tuned, I'll tell you all about that. But basically, what the research suggests is that you see two very different patterns of cortisol production in traumatized children. Very different from what you and I have, which is a cortisol awakening response, like our morning cup of coffee, gets us going, ready for the day, and then we see this gradual decline throughout the day so we can rest and get our sleep and do all the things that our body needs to be able to face the day tomorrow. Well, what you see in these little children who've experienced trauma is elevated, right, cortisol secretion across the course of the day, which, think about it, right? It's a stress hormone. It's trying to get you ready for fight, flight, get you going. It's like your natural caffeine. Think about a little kid in kindergarten like that, and then you wonder why they're throwing the desks over and things like that. But they worry more about the kids who have this blunted cortisol production over the course of the day, where it's like the dampening of the brain, the HPA system just shut down. It's too much for me. My life is too stressful. I can't make it. There's nobody here to help me with it, so I'm just shutting down. So you see that response, and there's some suggestion, because this is still, fairly new literature, but there's some suggestion that those children have the worst outcomes. So just a couple of pictures to bring the point home. This is a PET scan. The brain that has lots of red is a brain that's functioning. The brain that has all that black is a brain of a neglected child. So you see the fluid-filled cavities. You see less activation of the brain in response to the task presented. I just wanted to give you all another sort of take on this whole idea. Many of you have probably attended to the work of Jack Shonkoff, another great website for teaching and all that kind of stuff at Center for Developing Child at Harvard. But anyway, he's